Mrs. Stewart, my name's Alex. I'm going to be your nurse today until about 3 o'clock. Can you tell me your name and date of birth? Awesome, Mrs. Stewart. So again, I'm just going to get a full assessment to start out, but have you had any pain recently today? Okay, just a little bit discomfort. Okay, well today, our goal a little bit is to get you up and moving. A big thing after pregnancy and having your baby, you can have a lot of kind of cramping in your legs, but that could be because you're not up and walking. So we want to do that as much as possible because you're kind of saying your discomforts in your legs, a little swelling. Okay, well we're going to try to maybe get you up and prevent, they're called DVTs, deep vein thrombosis, but it's caused from not walking around. So anything else with your pain? Okay, again, I'm just going to do a little bit of assessment. So is it okay if I take your temperature inside your mouth? Sweet. Beat. Good. Okay. I'm going to take your blood pressure. Looks like you got a cuff on this side. All right. Looks about normal. I'm going to take your pulse real quick. Check respirations. Good. No labored breathing or respiratory distress. All right, so again, I'm going to kind of do a focused assessment based on just the birthing process that you've been through. So have you had any tenderness in your breasts? Okay. Any discharge that you've noticed? Okay. Any hardness or any lumps? How's breastfeeding been going? Okay. Pretty good. Good latching. Good. When's the last time you had a feeding? Okay. Good. All right. And have you been rotating breasts after one is empty to make sure? Good. Good. Okay. Well, I'm going to go ahead. I'm going to throw some gloves on real quick, and I'm going to go ahead and do that assessment. Let me know if you feel any tenderness, but I'm just going to kind of feel around in a circular motion around your breasts. Again, just let me know if anything's tender. Okay. I'm going to come across to the other side. There's no discharge noted on assessment. No hardness. Good. All right, I'm going to cover you back up. All right, is it okay if I lay you flat? Is that going to make you nauseated at all? Okay, good. I'm going to lay you flat, and I'm just going to check out your bowel sounds and also your fundus. Have you had any belly problems since your birthing process? Okay, I'm going to go ahead and lift your gown up. When's your last bowel movement? You haven't had one yet? Okay, that can kind of be expected. We normally want to look for about 24 to 48 hours, even 48 to 72 before your first bowel movement following having your baby. So we'll keep looking for that. And again, that walking around that we talked about earlier is going to help with that. Okay, so I'm just going to listen real quick. Good. Present in all 4 quadrants. How's your appetite been? Pretty good? Good. Okay, I'm going to go ahead and massage the fundus. So just an aside, so what I'm looking for is I'm going to palpate the bottom of the fundus, and then I'm going to look for the top of the fundus. I'm going to make sure that it doesn't get flipped around by keeping that second hand lower. So looking for, we're going to say postpartum day 1, we're looking slightly below the umbilicus. So I'm going to say about 2 fingers below, so about 2 centimeters. We are midline. Any pain with your fundus? Okay. The fundus feels slightly loose, so I'm going to go ahead and just massage it real quick, see if we can get a little bit harder to stop any hemorrhaging. So kind of what I'm doing, if you notice that it's very soft, Ms. Stewart, what you can do is kind of hold your hand where I am and put your hand on the top and kind of massage, and it's going to get a little bit harder. As it gets harder, that muscle kind of contracts, and it's going to stop some of that bleeding that you've maybe noted, but I haven't seen that part yet. So I'm going to go ahead, I'm going to sit you up just a little bit, make sure there's no nausea with that. And there's good. Okay. I'm gonna go ahead. I'm gonna take a look at your pad. When's the last time your pad has been changed? About an hour ago. Okay. Real quick, I'm gonna take a look at that. Have you noticed any discharge on it? Any bleeding? Okay, just a little bit. That can be normal. Again, with just the fundus kind of relaxing back down, you can have some slight bleeding. So let's go ahead and look at that. Okay. Looks like we got a mild amount of lochia. Looks to be kind of a serosanguinous color, so bucca. And so we'll just have you kind of keep changing that as you feel comfortable with. I've got nothing to be too worried about, just because that is a normal finding. I'm gonna go ahead and lay you flat one more time now that we got a break. And I'm gonna turn you on your side. Check out your epidural site. Alright, look at your IV real quick. IV looks very, very good. Any pain around the site? And no redness or swelling noted. This is not gonna look very neat. Okay, I'm just gonna go ahead and look at your epidural site. Looks very clean. We got a bandage so it's not open to air. I'm just gonna go ahead and pull your pants down just a little bit. I just wanna check to see if we have any lacerations following your birthing. Looks good. A little bit of redness and discomfort down there, but any pain that you've noticed with sitting? Okay. Continue just to keep a good help maybe for you would be to reposition as you feel necessary. Okay. And finally, I'm just going to go ahead and look at your legs. Okay. See if there's any swelling. Have you noticed any swelling past just like the discomfort? Okay. So I'm feeling warm legs. So good. Looks like good. Pedal pulses are 2+. Cap refill. Got blanching in less than 3 seconds. Good. We're getting good perfusion, Miss Stewart. A little bit eschar on that toe, but I don't think that's for this. Looks good. So what we're going to try to do, our goal maybe for today, is going just to be moving more, okay? Do you have any questions for me, Miss Stewart? Evan, you got any questions?
I kind of hurts when I urinate a little bit.
Urinate. Okay, so let's check out your bladder. So you don't have a catheter anymore, but have you noticed any distension, that you feel very full or anything like that? Have you noticed any color changes to your urine, any blood in your urine? Just a little bit. Okay, so we'll make sure that we check on that. Maybe we'll run like a urine test just to see if we have any changes in bacteria. So, anything else I can get for you right now? Okay. Sweet. Decent.